Hello, my name is Raj Thakkar and I'm a GP and Clinical Commissioning Director at Aylesbury, Vale and Chiltern Clinical Commissioning Groups. This talk is designed to help you identify and reduce risk of falls. There are a number of reasons why people fall, and one of them is being heart problems. You'll see on the screen in front of you there is a heart tracing of a patient of mine. This patient was falling and a monitor was fitted which gave the attached results. As you can see, she was not having a heartbeat for over 5 seconds, and that's why she was falling. The next day, she was fitted with a pacemaker, and she did not fall again. Of course, not all falls are because of heart problems. The cause of falls can be complex or quite simple, and it's really important to consider the risk of falling too. Please feel free to share this slide set with as many people as possible. Statistics suggest that 30% of those over the age of 65 and 50% of those over the age of 80 will fall at least once per year. Older people in care homes are 3 times more likely to fall than those living in their own homes, with the results of the fall often being more serious. Do not accept that falls are an inevitable part of being older, and a significant number of falls are preventable. We hope this presentation will help you reduce the falls risk of your residents. If you think about the falls risk of residents within your care homes, the questions to ask are: have they fallen in the past? What did it feel like for them? What happens if the resident did fall and could not get up? Many patients will have dementia, so it's important not to make assumptions if they cannot say how they feel. Don't stop exploring avenues as to why the falls happened though. If the resident has fallen in the past, they're more likely to fall again. Falls in the past 12 months are the most relevant. How the fall felt to them can tell you a lot about the possible cause. If the resident does fall again, or if they have fallen recently and can remember it clearly, maybe create a falls diary, making note of what they were doing when they fell and roughly what time of day it was. Did they feel dizzy or have palpitations before they fell? Did they lose consciousness? Do they remember feeling themselves hit the floor? If they tripped, what did they trip over? If the resident fell and could not get up, how will they call for help? It's important to consider this question and the above questions and be proactive to minimise the resident's falls risk. For example, having the call bell within reach and accessible would help the resident call for help if they fell over and could not get up. Also, small steps like making sure the residents have the right glasses, hearing aids and/or walking aids can help them to feel more confident. Falls cost the NHS £2.3 billion a year, and around half of falls are preventable. So £1 billion could be saved in the UK and reinvested into other health services. If people do fall and are taken to hospital, it creates a pressure on the NHS and stops people being able to access healthcare more easily. If the volume of falls was reduced, it could support the whole community. There are 70,000 hip fractures in the UK a year, and usually this is because of a fall. It can affect mobility and increase the risk of pneumonia and clots on the legs and the lungs. There are 10 times more hip fractures in care homes than any other environment. The consequences of having a fall to an individual could be personal injury, but it can also affect them psychologically. They could feel anxious about falling and become socially isolated or even depressed. It's really important to remember that falls is not a diagnosis, just like breathlessness isn't a diagnosis. If you have breathlessness, you could be anemic, have heart or lung problems, and the same applies to a fall. Falls can be caused by many different things. This will be explained in the next slides. If a resident is falling, do not make the assumption they are tripping over. Ask the resident how they feel, record what has happened and report it to the GP. Remember to share the falls record with their GP. So why do people fall? Well, a third of falls are because of problems around the environment. So turned up rugs and doormats, slippery stairs, loose slippers and wet floors, and slippery baths, wires and poor lighting can all lead to falls. So one of the key messages from this presentation is for staff to look at the environment in the care home and remove any hazards that might cause a fall before it's too late. Delegating a member of staff to do a monthly environmental risk assessment will ensure the care home is safe. Make sure to formally record hazards that are found. Muscular problems are very common too, such as muscular weakness, arthritis, and other problems like spinal disease and pain in the legs. So it's really important to encourage exercise to keep muscles strong, so if there is a fall, the resident can get up or correct themselves when they trip. It's important that physical activities are suitable and safe for the individual, and that staff or the resident's family and friends can provide adequate support and or supervision. Neurological problems are difficult to manage and can increase the risk of falls. It's important to speak to the GP if you're concerned about the resident's falls risk because of this. So this slide shows some further causes from falls. On the left column, we can see there are many heart causes that cause people to feel unsteady and fall over, low blood pressure being the commonest. So this affects people particularly if they're on blood pressure medication, but other causes too. It also shows that if the resident is falling, it might not be a simple trip, and it's really important to record the fall and report it to their doctor. The middle column shows issues that occur around the body that can cause people to fall, particularly infection. Urine infections can be increased by people not drinking properly, so it's important to make sure the residents stay well hydrated. Chest infections can be increased by smoking, as well as residents not taking their pneumonia and flu vaccinations. Vitamin D deficiency is really common in the UK, and that can cause muscle weakness. This will be touched upon in a later slide. On the right-hand column, I talk about the medication, and if you're on 4 or more drugs, you have a 30% increased risk of falling if you live in the community, and a 400% increased risk of falling for those who live in a nursing home. This is because some medications can increase a person's risk of falling because of its action or associated side effects, like dizziness, sedation, confusion, low blood pressure, or postural hypotension. Older people are more vulnerable to the side effects of medication because of age-related changes to the liver, kidney, brain and heart. So it's really important for residents to take their medication as prescribed, but also to chat to their doctor or pharmacist because it may be they can stop some of their drugs that don't add value. A review of high-risk medication, particularly medication that affects the brain, as part of a multifaceted falls prevention programme can significantly reduce the risk of falls a resident has. It's absolutely essential that we remain active. Being sedate can increase the risk of muscle wastage, poor balance and falls. If our muscles are strong, we're far less likely to fall, and if we do fall, we're more likely to be able to get up. There are lots of things you can do to encourage residents to keep their muscles strong. This includes balance exercises, gardening, housework, walking to the shops, and exercise classes, particularly yoga or Tai Chi. Exercise must be tailored to the individual to ensure they're safe and effective. Although not all exercises prevent falls, there are still many benefits from carrying out regular, safe general exercise. Chair-based exercise classes provide frailer residents with an opportunity to exercise in a group or one-to-one session. Group exercise has wider benefits, including improved social interaction, sleep and well-being. Care homes should consider whether it's possible to arrange regular exercise sessions for residents, including strength and balance if possible. It's important to ensure the person leading the session has appropriate training, knows what they're doing and is confident that the participants can manage exercises safely. Contact their GP if in doubt about someone's health and safety. Active Pucks is a county-wide programme that's run by the County Council and offers a wide variety of activities near you, from free local walking groups to Tai Chi classes. it's definitely worth logging onto their website or emailing on the address on screen to see what's available and claiming a voucher to have your first free session. It's important for care homes to correctly identify and treat malnutrition in their residents. There are many clinical consequences of malnutrition, one of them being an increased risk of falls. Around 10% of older people are malnourished or at risk of malnutrition. This equates to about 1 million older people in the UK, and as many as 37% of older people have recently moved into care homes. Ensuring good hydration and nutrition for residents is important for reducing residents' falls risk. 3 key areas of nutrition to focus on are protein, vitamin D and calcium, and hydration. Evidence suggests that as we get older, our bodies require a larger proportion of protein compared to our calorie intake. Think about the content of residents' meals and ensure that some snacks also contain protein to help maintain muscle strength. Good sources of protein include meat, fish, cheese, eggs, beans and pulses, corn, tofu, nuts, milk and milk products. Vitamin D is essential for our bodies to absorb calcium and to keep our bones and muscles strong. Vitamin D is created by our bodies when the skin is exposed to direct sunlight when outside. As mentioned previously, vitamin D deficiency is really common in the UK and can easily be rectified by investing in a vitamin D supplement for residents. Along with a high calcium diet, this can help keep bones strong. Milk and milk products are a good source of calcium. Making sure residents drink enough is key to their health. Residents who report feeling tired and who miss drinks between meals can be at risk of dehydration. Being proactive by offering and encouraging drinks between meals and ensuring residents can always access a drink can help them to be well hydrated. We can help them reduce the risk of urine infections and falls. It's important to be proactive in planning how a resident would cope if they had a fall. Having a plan can help them and you feel more confident. Consider how they might get help. You may want to look at getting the resident a pendant alarm, encourage them to carry a mobile phone, or make sure their call bell is at a height they could reach if they're on the floor. If you feel a resident would benefit from a personal alarm, ask their GP, social worker, or local council for more information about the range of telecare services available and whether any costs apply. Telecare equipment includes fall detectors, chair and bed pressure leaving mats, door sensors and much more. If a resident does have a fall, you may need to consider phoning 999 if there are any signs of serious injury and you're not able to assist in the resident getting up. Remember to always record and report any fall a resident has to the GP. Knowing how to manage someone who's had a fall is very important. If a resident has fallen, approach them safely. Remember ABC, airway, breathing and circulation. Make sure you call for assistance and check the resident for any sign of injury and ask them if anything hurts. Check if there's any bruising, pain, swelling, and check their behaviour. Is it normal? You should also consider the possibility of a fracture. Signs of this include pain, swelling, bruising, or deformity. If the resident reports they have head or neck pain, movement is discouraged. Make sure the resident is comfortable and await assistance from an emergency responder. Consider the reason for the resident falling. For example, was it a slip or trip? Did they faint? Was it from a known medical condition, such as blood pressure or diabetes? Or could it be due to medication such as a sedative? Make sure you refer to the resident's care plan or personal handling plan. There are special considerations to be mindful of when a resident falls, one of those being residents on anticoagulants or antiplatelet therapy, as they are at increased risk of internal bleeding. If the resident shows sign of serious injury, make sure you call an ambulance. You must keep the resident warm and calm. If the resident's fall results in a non-urgent medical concern, make sure the resident is monitored and any unusual changes are recorded. Always remember to notify your manager of any fall that's occurred. If the resident's fall results in no serious injury, assess the situation for safe moving and handling up from the floor. If the resident does not have a suspected head injury, consider the need for painkillers. Ensure any advice from your manager regarding observations and monitoring are followed, and notify the resident's next of kin or family as per their stated preference. When a resident falls, make sure an incident report is completed and always notify the GP if a fall has occurred. When completing a post-fall review, make sure management and CQC are informed of any serious or recurrent falls. Make sure the resident is reassessed for falls risk and make sure their care plan is updated and implement any required fall prevention strategies. Make sure all staff involved are informed of the incident, any outcome, and also the revised care plan. At the time of this recording, 30 care homes across South and Central Aylesbury and High Wycombe have access to video technology. Telemedicine provides secure video links to nurses and, if needed, doctors and other consultants in the nursing home hub in Airedale. They will provide support to the care home staff when a resident becomes unwell. The nursing hub will liaise on behalf of the care home with the primary care, secondary care or emergency services if required, which means the care home staff can continue to look after the resident. The nursing hub is open all year round and therefore provides cover not only in hours but out of hours too, including weekends and bank holidays. This means a telemedicine system becomes the first point of access if an urgent appointment is required. We're passionate about reducing falls in Buckinghamshire, and we're doing lots of things to improve the health of the community, and a large part of this is educating the public. Please listen to this voiceover and go home and look at residents, your own and loved ones' falls risk, and talk to a GP if you're worried about falls. It's really important to think about falls risk and what you can do to reduce it. It's everyone's responsibility. If a resident falls, make sure you record it and report it. Themes may be identified, for example, the time of day or a certain area in the care home. Think about residents' safety when they're out and about, for example, the use of walking aids, and ensure a risk assessment is in place. Spread the word to your residents, family and friends, and remember to encourage exercise on a regular basis. Remember the top tips in this attached leaflet to help minimise falls risk. Thank you for your time, and I wish you the best of health.